tied a lot of my digestive issues together. This program gave me latitude to feel empowered to be able to ask the questions I needed to ask.
Hey everybody, today we are interviewing Victoria, who's been struggling for over 10 years. She's been dealing with symptoms related with hormonal imbalances, brain fog, perimenopausal symptoms, chronic fatigue, digestion, swallowing issues, you name it. Through all these years, Victoria has worked in the healthcare field as an RN, as a healthcare provider, and now works strategically within health related companies and wellness companies. But it's interesting how even someone who has trained, delivered care, and works in healthcare even now weren't able to get her questions answered or the connections made between all these symptoms. I wanted to really interview her fairly early in her journey because just reviewing her labs, which is just one of the things we do in the Transform program, we were able to, by leading with curiosity, tie every single one of these symptoms together. So what I would love for you to do is watch this interview, think about just my perspective when I think about the 5 W's on leading with curiosity. And I love also the question, which really isn't a question, which is tell me more. When you allow people to tell you more, she is a plethora of information, which revealed that there was all this family history with thyroid, with goiters, with cancer-related lesions, you name it, that really contributed to answers in her story. There were pieces of this puzzle. So I want you to think about your healthcare and your symptoms as like all this puzzle. It's there, there's a solution to it, but who's looking at the patterns? Who's looking at the pieces that connect? What are the pieces? Who do you need to help you? When? How? What? Right? And tell me more. All these different types of questions. So by using those questions, we came to some very different answers for her healthcare and her outcomes and a solution to these symptoms. So take a watch. Perfect example, very early in the program, of how an approach of leading with curiosity is going to kick some ass, take names, and chew bubble gum. Hey, everybody. Today we have Victoria here, who's currently one of our programs and has been working with me and our team. And about a week ago, Victoria had a laboratory review. And I thought, what better way to demonstrate what leading with curiosity looks like than to actually go through and talk about what happened with Victoria's lab review and how the approach of leading with curiosity versus being spoon-fed and told what we're supposed to do with our labs, passively receiving instruction. How is it a completely different health and life-changing experience it is to lead with curiosity, and how does it look different? So I want to welcome Victoria today. Victoria, welcome. I would love if you could tell us a little bit about you.
Well, I am almost 52. I have a wonderful 15-year-old, and I've been married to my husband for, we're going to be hitting our 20th anniversary soon.
Wow.
And I'm actually in healthcare myself. Started off as a nurse, and now I do strategic business consulting.
I didn't know you were an RN before. What kind of work did you do as an RN?
I was just general clinical support type of thing. So I worked in hospitals, home health, that type of thing. And then kind of moved into another space where, in addition to being able to help on this one-to-one level, started to work on system level changes. And that's what kind of ended up bringing me to the work that I do now with multiple partners.
Okay, so this adds a whole extra layer to the conversation because whenever we have a conversation and someone has worked in healthcare or is currently in healthcare, coming from almost behind the scenes in a way. So I really want to bring to the forefront how what you've experienced in the program the last, month or two has been leading with curiosity. And we mentioned right before this interview started, you mentioned something because I was going to ask you, you said, I'm working on better work-life balance now. And I said, well, what would that look like? And would you be open to sharing what your response was around that?
I was honest. I said that, boy, that's a loaded question.
Yes. Why, yes.
But, and it means different things to different people, but I like the way that you phrased it back to me around why don't you picture what you're hoping for, which is what do I work with my clients on? What do we work with patients on?
The vision.
You're right. Exactly. Make that your reality. And then how do you walk towards, achieving that. And
Yeah.
I was sharing with Dr. Maggie that part of this program has really given me an opportunity to look at those things and notice these things differently, in spite of my healthcare background.
Yeah. What I was sharing with Victoria is sometimes for me, like where we engage our creativity and curiosity sometimes is what I call reverse engineering. So if you lead with curiosity and creativity, and you could already see and dream with very specific specificity what the outcome is going to be, right? What it is already. And you really sit there as all those outcomes, every single piece of that. And all you have to do then is to say, how do I reverse engineer that? How can I make this happen? And the vision and the creativity is the most important part that leads that process. And a lot of people start on this end trying to get to that end, but they never know what that end really is, which is why for me, how do we get to that pathway? And you have to lead with a creative mind that's really led with curiosity. And we're going to talk about something relatively boring to most people, which is laboratory work, lab work. In our experience, in my experience as a doctor, your experience as a nurse, and now working in strategically in healthcare, lab work typically to me is people come to a doctor's office or a clinic. They think they have this big menu, but what they're really getting is a very short, small panel of options for lab tests that their doctor decides is the best labs for them. Number one, you have a defined menu. Reminds me of, have you ever seen the Saturday Night Live skit where you go in and every time you go in and no matter what you order, John Belushi says, cheeseburger, cheeseburger, cheeseburger. That really is how we actually deliver lab testing and the options for healthcare, is that based on one or two symptoms that you have, you're going to get a cheeseburger for that symptom. So limited lab testing. Number two is we go into, as a receiver of that healthcare, we basically go to the doctor and they just tell you what to do. We take their interpretation and their understanding of it as whether it's normal or not. We take their word for it. And it's just a decision making of like, well, what do I got to take? What do I got to do next? Really like almost algorithm A or B, like a binary algorithm of A and B. Well, if your labs are normal, you must not have a problem. Or if your labs are abnormal, here's the medicine you take or the next test you take. So in a very binary model. And we as the recipient of that care is really just sitting here like waiting to be fed. Is it going to be A? Is it going to be B? Next move. Is it going to be C? Is it going to be D? Next move. It really is like this binary system that's lacking in curiosity. And what I want to show is, I mean, Victoria, let's go through the top 5 symptoms that you've had in the past, let's say 5 or 10 years. How many years have you been dealing with your health symptoms? Hi, I'm Maggie, UMD, and I'm a functional and holistic medicine physician and the creator of the Transform and Transform protocol. If you're interested in learning what are the root causes of all chronic disease, go ahead and click the link in the description where I have a power pack 30-minute training that goes over what are the 5 pillars of Transform. Go ahead, click the link, and I'll see you in that training.
I've always been to some degree anemic, but it got much more severe. So lots of weakness and fatigue, inability to sleep.
Insomnia.
Insomnia. Then it started to worsen in the digestive area when not being able to take in foods or keep down foods. So experiencing degrees of weight loss. And then more even related to circulatory issues. So having a lot of chest pains and palpitations. And of course that started going. And but by then already there was more hair loss. So things that you could more visually see.
Right.
And so things that, and massive cold intolerance. Oh my.
Yeah.
Like painful in the cold, and not just, oh, it's because you're so thin.
Some people have a cold intolerance so bad the arteries actually like really almost constrict, causing a symptom we call Raynaud's. So we're talking chronic fatigue, Raynaud's, digestive issues, starting out swallowing issues, hair loss, brain fog, mental health symptoms, cold tolerability problems. I mean, this is a decade plus of this, correct?
Oh, absolutely. Yeah. The cardiac issues, the digestive issues. I mean, just building upon itself little by little.
Okay. And here's what we found. So when we went over some labs, we went over a couple simple labs. Simple, I say, but we're drawing some labs that weren't very expensive to do. And some of them had never been done, even though they were not necessarily expensive. Like I mean, we were looking at things like vitamin D, where we're looking at someone's true B12 status, not what your doctor thinks, but like the true inside the cell B12 status. We're looking at things like her stored iron. We're looking at her true thyroid function. Was her thyroid really functioning? And we're looking to see whether she had autoimmune of her thyroid or not. Now, without being led by curiosity, she's had some of these labs done, and you were told your labs were what on those things?
Normal, little issues here and there. You've menopaused, and so, that explains it. Here's a bunch of iron.
Okay, so you're in menopause, therefore you should have chronic fatigue, weakness, digestion issues, trouble swallowing, hair loss, mental health symptoms, cold intolerance. Is it normal for someone going through menopause to have all those 10 plus years of these symptoms? And the answer is hell no. So without being led by curiosity, many of you guys have had lab tests done that she's had. She's probably been told that her thyroid was normal. What did they tell you was the underlying cause of your anemia? I was curious.
Just iron deficiency. So they're saying that probably wasn't taking in enough. I think in one of my doctor visits, they said something like, oh, you know what, eat a banana. Maybe you should consider not being a vegetarian anymore.
So in going through her labs, what we found was every single one of these labs are not normal. So she had really low B12, she had really low iron, she had really low vitamin D, thyroid was low. And we also discovered that the likelihood it was autoimmune was, what did we end up saying? That based on the laboratory values and your symptoms, what was the percentage where we said this would likely be an autoimmune disease of your thyroid?
Oh, like over 90%.
Over 90% certainty.
Yeah.
Okay. And so I want to take a look at these labs and I want to tell you where it leads me. So for example, let's start with, she had vitamin D that was low. And in looking at someone with low vitamin D, immediately I start thinking about how it leads me to question, because vitamin D is not just a vitamin, it's a hormone. And I know if someone's vitamin D is really in the shitter, that the likelihood that they're going to have thyroid issues, hormones that affect blood sugar issues, her ovarian hormones, her adrenal hormones, the likelihood that those are going to be really low and suboptimal is going to be extremely high. Based on just low vitamin D, it already starts ringing alarms to me as to all the other hormone systems that could be involved, because we're asking more questions. I have 5 W's. Who, what, where, why, who, what, where, why. Oh, I can't remember the last W. And then there's always the last question, which isn't this question, which is tell me more. So immediately, based on vitamin D, I'm already thinking, what else is going on, right? Why would her vitamin D be this low? Are there other chronic hormonal issues going on? It starts to think about blood sugar issues, her insomnia that she mentioned. Does that have to do with her hormones? Remember, there's a vitamin D receptor on every cell of your body, including the cells that make hormones. So I wouldn't be surprised if her vitamin D is in her shitter, I was going to go through her thyroid labs next, and that was going to be problematic. But remember, she's been told that her thyroid was fine. How? By just doing a TSH test. We give a medical provider who's a medical person and working in healthcare 10 years of symptoms, 1 TSH test, repeat that test over and over again, maybe, and tell her that her thyroid is normal. But what did we discover about your thyroid when we went over your thyroid?
Based on where my TSH was, when we looked at the T3 and the T4, they were not in a good way, and actually largely indicating autoimmune that is attacking my thyroid. And then it reminded me, triggered for me, and I had mentioned that it does run in my family, that my aunts, even my mom, have had thyroid issues, goiter, and just, we said, well, it's fine, we'll deal with it. I think one of my aunts had surgery, but we just moved on.
Well, this is asking more of the question, like, who else has these issues? What did they have? Why did they have these? The autoimmune diseases that anybody has is also genetic. The likelihood that a mom will pass that gene to a girl is like 90% for some form of autoimmune disorder. And these are the missing links. I loved asking these questions because it was like, as we were going through the lab, I was like, but wait a minute, my aunt had this, but wait a minute, my mom had this. And which led me to the question is, had anyone ever dug deeper beyond the TSH to say, what else is needed? And should we run autoimmune labs on you? Should we even ask this woman about her family history to consider, is there an autoimmune component to this problem that she's had for 10 years? Has any of these questions ever been asked by any of the individuals that you worked with?
No, not at all. Not at all. I had to search around and try to pursue it on my own. And until I came across your program, did it really fully call it out in a way that tied everything together and gave
Yeah.
me the pathway to be able to ask more of these questions. But no one had ever said anything about it.
It's interesting. When you do ask these different questions, it may bring you to order additional labs, or it may bring you to actually look at even the same labs in a different way. Can we look at the same lab? And can it tell us different messages? Victoria's lab showed she had really low thyroid hormone production. Her thyroid didn't make enough thyroid hormone. And secondly, the thyroid hormone had to be converted and activated to another active thyroid hormone. That number was I'm gonna excuse my French. I'm a fan of the cursey words, but that was in the shitter. And I asked. I'm gonna ask you: did anyone ever run a free T3 on you?
Never.
10 years. Cold intolerance, chronic fatigue, brain fog, mental health. No one has bothered running a free T3, which you guys will learn on this is the only thyroid hormone that's actually actively doing anything. It's an active hormone. And her functional range was way lower. So no wonder you had cold intolerance, right? And then I'm going to tie this all together. Don't get me wrong, everybody. So right here, I did mention that total T4, and we talked about free T3. Your thyroid hormones have to be actually actively converted to the active thyroid hormone. And where is it converted? See, we have to think who, what, why, where, right? Where is this conversion and activation of thyroid that happens from, the thyroid makes it, but where does it turn into that active T3? Do you remember?
Liver? Wait.
Yes. It happens in the liver and it happens in your intestines. Yeah. So, I'm going to tie it back to when you leave with curiosity, this is going to, like a snake, that's going to lead back right back. Remember she says she had digestion problems and trouble swallowing? It's linked to her thyroid. Yeah. So the reason that she was also having low active thyroid hormones, because there were problems in her digestion and in her gut and in her liver that was causing the inactive thyroid hormone not to convert to the active thyroid hormone, which then ties in these other labs. We're going to keep going. So one of the things we learned when we were talking about B12 and iron, why did she have really low B12? And why does she have really low iron? So when we look at iron, we don't just look at anemia and say, oh, you have low iron, take some iron. I really am interested as to why. Why is she low in iron? What are the different ways with which you could have low iron? And we went through all the different ways that could have low iron, and we figured out, what were some of the underlying causes of your low iron?
Well, it sits with challenges in terms of my intake and being able to process it, and then also output. So because I'm vegetarian, I don't, take in a whole lot of high iron foods. So that's
intake problem.
And then I do have bleeding, not I'm menopause, but I've had blood in urine, and so
chronic blood loss through urine. So there's an output problem.
And then digestive issues,
in between,
unable to absorb, and so however much iron I take, nothing's gonna.
So a doctor can say, yes, you're anemic and here, take some iron, but it never went up. Why? Because nobody ever really went deeper and say, why is this happening? Where is this happening? And who does she need to see to fix this problem? Those kinds of things. And so number one, as a vegan or vegetarian, intake is going to be an issue. So she really needed to get educated on what are some sources of iron that are natural, that are highly absorbable, and what's enough. What is the amount based on her laboratory value science? Number two is that she said she had an output problem. She was chronically losing blood in her urine. And to me, when I think about it, a lot of people, it could be blood in urine. Some people actually have a lot of bleeding, whether from hemorrhoid or from gut, because they have autoimmune diseases in their gut, like ulcerative colitis or Crohn's. And then for women, most commonly, a lot of times, is heavy periods. Why would she be having heavy periods? Let's say before she had hit menopause, was she having a lot of heavy periods? If so, why? Why was that going on? What's going on with her hormones? How's it linked to the digestion and her thyroid? Huge. How's that linked to her vitamin D? Huge. We're coming back full circle. One of the things that we learned in what that we teach about in the program is how to use simple labs to know 100% someone has a digestion problem. And in her B12 was terrible, and so was her stored iron. Okay, we're looking at those reliable labs. And you learned, and we talk about how, why would those two vitamins being low pretty much guarantee that you have a digestion problem?
Because I'm not able to convert anything or absorb anything. And so I'm not able to intake properly or process. And it's just a vicious cycle.
Well, you know, but both B12 and iron require stomach acid to absorb. So in her case, both of them were in the shitter. And she had problems with swallowing, probably a history of heartburn, irritable bowel, those kinds of things. Yeah, her eyes just lit up. So does Victoria, not just because she's a vegan, does she also likely have a problem with some of the stuffs in digestion, especially low stomach acid?
Yeah.
Yeah.
Anytime you have any sort of pain or trouble keeping things down, they'll say, take an antacid. And I'm like, well, no, that's not really helping me, but no, take more antacids. And until I got into the program and why that was happening and that there was even remote possibility of low stomach acid, did it dawn on me how that tied a lot of my digestive issues together. And it didn't hit until then.
What I like about looking at these labs, just so you guys know, is that we're able to take every single one of Victoria's symptoms and tie it together. And my question is, we provide learning experiences for you to learn with curiosity. And I want to ask, how is learning about your health in this way? How do you feel like it's lit up curiosity or your ability to?
I feel like giving me a platform to, like you said, pull things together. So I feel more empowered to be able to ask the questions.
Yeah.
And on top of that, you talk about the labs, you talk about the physical symptoms, but also there's the mindset piece to all of it. I have pulled into it. And it really gives you this additional place to look at this through a different lens and have that perspective so that when you are asking these questions, because I am in healthcare, like I don't know if maybe I just accepted things, didn't think about it, or how I prioritized it, but experiencing this myself and seeing this tied together through the program, what it did was really it's like it almost gave me permission or helped me to give myself permission to just say, well, why can't I ask these different questions? And why is this the end of the story? Why can't I wonder about what this will be? So worried about making sure that, okay, just get better, help other people get better, take care of these things. But how am I going to do that if I can't sort through and ask the questions I need for myself? And as it manifests itself on me physically.
Yeah.
But this program gave me latitude, not just to understand better, but to feel empowered to be able to ask the questions I needed to ask.
It's like, I remember just looking at your thyroid, and it was one aha after another as we pulled in all the history and we looked at all the numbers. We tied in the digestion. We also tied in the autoimmune link. I guess my question is, I know how I felt, but how did you feel as these answers were coming up and all these things started to tie together? What was one dominant emotion that what was your reaction?
Well, it's kind of a bit of a flood of emotion, as you can see, because I felt sad that I lost all that time. But at the same time, because of what I'm learning and what I'm trying to put forward, and maybe it's that part of the curiosity, trying to layer in a level of gratitude. This isn't the end of the story. Do more, I can ask more, I can try other things, I can't. But it was just sad to have lost some of that time.
Right. That's the story. Your story is that I lost that time. And I think with my curiosity, did it take that amount of time for you to get to the place where you were ready for the answers?
Right.
It took the exact amount of time for you to get to the place where you're ready, Shin. You're ready to take that all in. I mean, you're living your life this week different than you were last week. I'm going to ask you something, which is, in your quest to get better, how many doctors do you think you went through?
I'm going to say at least a dozen.
That in your quest, and that's a place where I think curiosity comes in. What made you curious enough to do something completely different about your health? What made you join the program? What made you decide to work with us?
Because I felt like I really felt like I was dying. I describe my family and the work that he do. I have to live to do that. I have to be here to do that. And so I have to make a choice. And, a big part of what I do is functioning around like system level changes. Yeah. And so if the path isn't working what you're doing,
yeah,
you have to try something new. I mean, it's already not working.
But that's the curiosity. You know what that is, Victoria? Is like, I was thinking about that. Some people need to get so sick in order for it to be the leverage, the push they need to do something different, which is what you did and also what I did, like many of us. And sometimes some of us who are like workhorses like you are and I am, if I just worked harder at it doing the same thing, it's going to make it work better. And it's only when you like hit a wall where no matter how hard you work in it within your own capacity and you cannot change the outcome, that you realize there's a realization, there's a switch that says, I got to do something really different about this. Exactly. And my thing is, if you lead with curiosity, that point, exactly. But at any point you can decide to be curious. We don't have to wait till like we have no other choice except I think I'm going to lose my life or I think I can no longer function at this job. We don't have to wait that long. We can lead and start with curiosity.
If I kept doing the same thing over and I would keep coming up with the same result. And if that is the way the system is going to continue, that this is the kind of results we're going to have: high healthcare costs, people with lots of outcome issues or problems that aren't recognized until they're so bad, all their hair's falling out. They're really sick, can't eat, can't sleep.
Well, what I'm excited for you is that this is really early in your journey. Literally, we reviewed her labs. Notice any change. It's only been a couple of weeks since some of these changes you've implemented. What have you already noticed in the last couple of weeks that feels different than the last decade?
Well, certainly, first and foremost, I'm seeing and noticing things differently. Mm-hmm. And it's prompting me to ask more questions mm-hmm. and be comfortable with that. I am physically still making my way through, but I'm a lot more aware of things that, having removed gluten and drinking more water, what helps me to mm-hmm. feel better, what helps me to get through the day. Mm-hmm. And just being able to and giving myself permission to walk through this in the way that I need to, in the time frame I need to, but with the evidence and the confidence to be able to do so that I can keep moving forward.
I like the word confidence, because one of the things for me is that when you lead with curiosity and you get the right data, you get the right education, you also have reinforcement of what she felt in her own symptoms and in her own family history and in her own personal history. It really validates the why this has happened to Victoria. So what I'm manifesting, and I would love to have a follow-up interview in a couple months or in a year, is that this is how you level up in confidence. And the more confident she is about this, the more she can become the leader and the driver in her own health care. And for me, it's really important that this is about health by design. And when you have your health by design the way you want it, then you can have your life by design. So there's no restriction or fear that, oh my God, I'm not going to be able to work because I'm sick. No, I'm well. And so now I can design my life the way I need it to be designed. I can design my relationships the way I want it to be designed. So I can't wait to see what happens and unfurls for you over the next couple months or a year. And I would love to have the opportunity for a follow-up interview with that.
I'd love to do that too. And I just wanted to say thank you. Thank you so much for helping me get through this and providing this out there. It's creating a bigger ripple effect than you probably could ever.
Thank you, Victoria. Hi, and thank you for watching this video. If you're interested in actively looking for a solution to your problem and you'd like to work with us, I'm going to invite you to go ahead and click the link in the description to book a chat with our team. What that's going to do is it's going to bring you to a calendar, pick a time that's going to suit your needs best. It's going to be about a 15-minute phone call. After you book that call, there's going to be a link to a short questionnaire, and that's really important for you to fill out because it's for us to get to know you better and helps us to better prepare to make the most of our time together. After you fill out the short application, it's going to take you to a page where there's a couple resources. What I want you to do is go ahead and click 2 of those and watch those two trainings, they're going to really best prepare you for your phone call with us to make the best use of our time together. I and my team look forward to talking to you to learn more about you, to see if we are indeed a good fit to work together. Thank you.